if you are a guide, you're credible, right? People want to trust the direction that you're moving them, then I think that also does a lot for improving possibilities that people will have vaccinations. And again, like our important thing is we want you to have the information that you need to make the best decisions for yourself, your families, and your children.
Welcome to the Bronx Health REACH Community Coalition podcast. I'm Anthony Davis, who will be hosting the podcast. I'm a community health worker with Bronx Health REACH, an 80-plus member community coalition launched in 1999 to eliminate racial and ethnic health disparities in the Bronx. For this podcast, we will be talking with folks involved in the doula, perinatal care navigator, COVID-19, and flu vaccine education pilot to address the low vaccination rates among pregnant women. This program was launched by Bronx Health REACH in collaboration with the Institute for Family Health's perinatal care program and Bronx ReBirth and Progress Collective. Today, we are speaking with Evleyn Alvarez from Bronx ReBirth and Progress Collective. Welcome, Evleyn. Can you please tell us about yourself, your organization, Bronx ReBirth and Progress Collective, and what you do?
Sure. My name is Evleyn Alvarez. My pronouns are she and they, and I am a co-founder of BX Rebirth and Progress Collective. And so we are a collective that started in April, May of 2020 as a response to the challenges that were being experienced by our communities as a result of being quarantined through COVID-19. The three of us, myself, Nicole Jean-Baptiste, and Carmen Mojica, all met as doulas, although Carmen is also a midwife and Nicole is an oral historian. So soon after we collaborated to collect funds and distribute diapers, wipes, and formula throughout the Bronx and our community, we decided that we're doulas, we should offer doula support as well.
Pregnant and breastfeeding women carry one of the highest risks for complications from COVID-19. Yet, pregnant and breastfeeding women vaccinate at a lower rate than average non-pregnant adults. Pregnant women are at high risk for COVID-19 related severe illness, in many instances needing hospitalization and sometimes resulting in their death, as well as suffering high rates of preterm births. Currently, only 13% of pregnant women in the United States are up to date with their COVID vaccine. Hearing these statistics, what is your reaction as a doula and one of the three organizers at Bronx ReBirth and Progress Collective?
I mean, I think that part of the challenge is that people often, rightfully so, right, in certain communities, the Bronx is no exception, have limited understanding of what vaccines do, how they work, what the timeline is, and what the full range of benefits are. And so I think that without having relationships with people who can give them not just anecdotal, oh, I heard that wasn't working, but really having a combination of relationship with people who are both going to give them the anecdote, but also give them enough information for people to make the right decision or the decision that they feel is right for themselves and their families, that definitely leads to lower comfort levels of receiving vaccinations, and that, I guess, impacts the data overall.
Okay. I guess that's why it's so important for everybody, especially pregnant or breastfeeding women, to be educated on these vaccines and
Right.
how
Yes.
they could play a part in their lives and their child's life.
Right. And not
Um,
just to receive, I think that it's also important to name that it's not just to receive the information, but it's also to receive the information from someone that you trust, that it doesn't feel like coercion, it doesn't feel like you're forcing me to do this, but that you're really giving me information and inviting me to be the architect of my life, right? That in our role as doulas, that's one of the things that we do. We offer resources, we offer supports, but it's also done in a really objective, non-judgmental way of here's the information that you might need. This is a prediction of what is going to be on the pipeline. These are some of the decisions that you may have to make in the next week or month. And so these are the things that you may need to be able to support your decision-making process.
okay, great. So could you actually further explain like the doula vaccine education initiative and the role that you have played in it?
Sure. So the vaccine initiative is really an innovative program conceptualized and ran by Mariah Bernzales at the Institute. And really what it was just realizing like, who are the people that are credible messengers in community that can offer this information where you are already going to have an ongoing relationship and commitment to engage with pregnant people. And so we were recruited as a partner, which is really great. And it allows our doulas to really offer another layer of supports for our clientele, right? Like they do ask us questions, or they have historically asked us questions like, what is this? Like, what do you think? Is this vaccine calendar schedule worthwhile? And so I think that with that and having that unique entry point in the relationship that we have as doulas, it makes doulas in general, but particularly us because we're Bronx based and we're also wanting to include and improve the numbers, and if only for people to have more information, right? Like for us, it's really an opportunity for us to offer information to our clientele that is evidence-based, that goes beyond, like we spoke about before, that goes beyond the, oh, I heard that so-and-so got sick, but like really being able to tell someone, yes, people might get sick, but it's X amount of people that get ill out of any vaccination group, things of that nature, right? Like we're able to really throw out and toss out facts and evidence without it feeling super clinical or unrelatable.
Great. Yeah, I know from because I'm a community health worker, so I know when speaking with people about um COVID or flu, even that the more clinical or the more statistics you include, the less interested they are, or the more afraid they are
Yes.
to talk about that subject.
Absolutely. Right. And that, I think that that ability to really give information in a way that doesn't feel alienating or confusing is really part of what allows us to actually deepen the conversation a bit and be able to give information without people feeling like, oh, I have to know all this. It's like, we can talk the science, so we drop in science, like we say, right? But we're not it doesn't come from a person who is a named scientist. And I think that that is also really important for our community.
I really like that drop in science. I think that's a cool little thing. But speaking on people that are like afraid. I already know that from like doulas that I've worked with before as well that they experienced the pregnant and breastfeeding women that they were working with, patients that they had, that they were afraid to get vaccinated both during the pandemic, but then it was even harder for some after the CDC declared that it was over.
Mhm.
How do your doulas convince pregnant and breastfeeding patients that COVID is still a threat to them and their baby's health?
Right. I mean, we bring data, right? Like we will offer current information that is also available and remind them that it's not over. So, when our doulas largely go to visit someone at a postpartum visit, for example, we're still wearing masks. Right? We're still wearing masks because it protects the family, it protects us, it protects any other family that we're working with. So I think that when people see that, then it's also it's a modeling of care, right? It's a modeling of protection. It's a modeling of recognizing that we are in this space and also really giving them information, right? That again, it's information where people are invited to be the decision makers, but also recognizing that we do have information, right? Just today, the New York Times sent an article about, shared an article about vaccination. And while it wasn't quite about COVID, it also is important to note that these are conversations that are happening consistently about different things. And so really being able to again utilize the relationship that we're building with a client to be able to support them in navigating like what is a contemporary issue that is impacting that can impact my life, right? Like my children's wellness. And one of our co-founder, Carmen Mojica, she's definitely very equipped to to be able to, she's been really into the COVID and how it affects the body. And so I think that's also been super helpful for us to recognize the importance of it, right? But also like, how do we give people ultimately the information they need and the data that is relevant and added, and available for local people to really feel that, oh, there is a pain point, particularly in New York City, in the Bronx, to be able to say, like, when you get COVID, even if the guidelines shift, that doesn't change the impact that it has on your body, right? It doesn't change. And for a lot of our clients who are people that need to go to work, for instance, right? They need to be at their healthiest. And also the way that we still don't know how COVID impacts some of the more common issues that we have, right? What does COVID do with diabetes? What does COVID do with hypertension, right? And so really being able to support them and understanding that if you have these, in particular, if you have these, or if you don't, or if you love someone who does, these are all ways that you can protect them. And if you live in a communal space, you may live in a multi-generational household, these are all things that you may want to consider to protect yourself and protect your loved ones as well.
Hey, great. Thank you. So we were speaking about how COVID is can really affect these women, but just to touch on flu and RSV, um, would you say that a pregnant woman, if they are infected, would it be deadly at any point or could be deadly with
I mean,
flu or RSV?
the flu, certainly we don't know because we don't know how these. The short answer is probably yes, and I think that a more fleshed out answer is the idea that we don't know what other things people may have where the flu can actually impact them more than another person, right? And so being able again to protect ourselves from different experiences, from protecting our children, from being able to create the space where, for example, lots of our clients have small kids, they go to school, and so like being able to protect their kids from having the certain illnesses when they go to school is helpful, for lots of different reasons, right? Obviously no parent wants their children to be ill, but then also the idea that if, for example, you're a parent that is working a per diem job, for instance, right? If your child is sick, you can't go to work. So if you can't go to work, that impacts your bottom line. So beyond it's beyond your physical health, right? It's your emotional health, it's your financial health. All of these things are impacted. And so really being able to have those kind of like just real honest conversations with our clientele of like, look, this is what you might have to do, right? Or this is the information that you need, is certainly, I think to date they've found it very valuable to be able to have those like beyond pregnancy conversations with your doula.
Yeah, I mean, information need about any of these vaccines and how these pregnant women would be affected by the viruses if they weren't vaccinated. I think that's just important information in general. I find it alarming that the percentage is so low of pregnant women and breastfeeding women to being vaccinated. It's just
Yeah.
I
I mean,
wouldn't think that, especially if you want to protect your child, your family. Like, I find that very interesting. But
lots
oh
of different reasons, right? And I want to name that it can be lack of information or it can be fear. And I think that also that fear comes from not having optimal information that has led to really have more complexity in the decision making. So it it kind of makes sense. I think that lots of people are largely reluctant to instinctively do a lot of things when they're pregnant out of a protection of their baby and themselves. So I think that is another reason why this information coming from the doula or giving them alternatives that maybe they would not have known were available to them feels very reasonable, right? Like when you're pregnant, you often are thinking, especially in the US, right? Like, oh, you can't drink, you can't do this, you can't do that. So there's lots of reasons as to why a pregnant person might say, oh, that may be something that I can delay as well, without recognizing that they do have full access to vaccinations, or access to vaccinations, right? I wouldn't say full access, but access to vaccinations. And that's something that I believe would be really important for people to know. Lots of our clientele will say, "Oh, I didn't know I could do that." Or I decided to wait it out because I was concerned on how this might impact my baby. So being able to come with real numbers, with real data as a way of helping them in their decision-making process is is valuable for everyone. And I think that even if they decide that they still want to delay or maybe not take the vaccine at all, they're still doing so from a point of informed decision making, which is exactly what we prioritize.
See, that makes more sense because, like, in the environment that I grew up in and I was raised in, my mom was a doula. I had a whole bunch of family that were part of the healthcare system. So that support and that education was kind of like already there. But
Mhm.
someone that doesn't have that, they would be afraid. They wouldn't
Yeah,
understand. And
yeah, they would be right, and that feels very logical, right? Particularly with all of the ways in which our, we hold um the time of pregnancy, rightfully so, very sacred. And so I think it people wanting to do the least feels instinctively smart. And I think that what we know now is that really having as much information as you can about any of the decisions that are available and accessible to you during pregnancy, from people who are also credible, is super important. Because other also what happens is that we hear so much information about the exchange that happens very often between a pregnant person and, say, their obstetrician. That time is short, right? So there may not be as much time to also ask the questions that you need to ask in order to get the guidance that you need to make the right decisions for yourself. So being able to have this secondary, really valuable relationship that has been cultivated with a doula in particular, in our case, really does invite people to get some of the additional information that they may not get from their experience at with their obstetrician in particular. Midwife is a little different, a lot different actually.
okay, so for the doulas that have their patients, what advice would you give them about speaking about COVID, flu, and RSV vaccines?
Well, I mean, I think in this case, for us, one of the things that was super helpful is the training that was created by Rooted. It's an organization that does information. And so they created this really beautiful training that has lots of information, but feels really easy and accessible. And so I think that for doulas or anyone else who's doing work like this, it would really be to do the work to get some level of training or read things and then be able to do their work to make it digestible, right? Very often we introduce and convey these things as if they're like super highbrow, but people are making decisions and they should be able to have um, access to ease in making that decision. So I think that having that information and making it like simple to understand and to get the information that people need, I think that's the most important thing. And that's one of the really beautiful things that doulas do, right? We are consistently translating. So we're previewing. I always joke that we review and preview, right? Like we're like, let's tell you what's on the pipeline, but also, wow, you did that. Like you made a decision. Like, it can be all the things that sometimes people really need support around. So I think that as doulas, we can continue to be amazing. We can continue to really pour into our clientele, the families that we choose to work with and that choose to work with us, and really take operate from that position of, wow, I'm honored that this family chose me or wants to work with me in this specific way and give me access to this very vulnerable time in their lives, and do everything that we can continue to do to ensure that we give them support and resources and information for them to be able to get as close as possible to the lives that they want to experience for themselves and their families and their children.
So, for these doulas that are part of the vaccine education program, what impact has it had on their ability to educate their patients about obviously the necessity of being vaccinated?
Right. So they continuously educating their patients and educating themselves. And so there are some doulas who might have said like, "Oh, I didn't know this," right? Like I didn't know that was the case. And so really um, in all things, doulas work and live and also learn right alongside their patients. So I think that for the doulas, what it's done for them is really expand their skill set in being able to convey medical information. It has connected them. It has given them information that they may not have been aware of, and it's also positioned them to be able um, to influence a life or lives as we've continued to do. So I think that they've been engaged and quite frankly surprised by how much interest their clients have shared. So what our doulas do is that they go and they ask their clients initially, like, would you be interested in learning more about this? Or are there any questions that you have about the vaccination? And just today, one of the doulas was like, wow, like I was really surprised at how many people really wanted to get that information and share and really be able to invite the possibility of this information being a factor that they utilize in their decision making and how they set their timeline for vaccination, for learning, for communicating with their doctors. So I think that there has been a link between this in receiving this information and then also being able to improve the way that you advocate for yourself, right? It's like, wait, I know that this appointment may soon be over, but I just have a question, right? About like asking your pediatrician if your baby is born, asking your OB or your midwife, like around their perspectives of how to make the decisions, right? So I think that all of this is also really important because more importantly than, also giving the information is inviting people to be architects of their life, right? To make the decisions and not just accept things, but to ask questions that they feel they need to have answered in order to make decisions for themselves. So what I envision is that this capacity build is also, it's for now, but it also positions parents and caregivers favorably to be able to make and ask decisions around their children's health in the future as well.
Great, great. So, with this education program, would you say that more pregnant and breastfeeding patients have been getting vaccinated or have become more interested in getting vaccinated?
Yes, I would say that they probably, once people have the information and they can make it for themselves, and they can also figure out like, oh, these are vaccinations. That's what it's for. Like, this is the timeline that I should have it in. Like, there are lots of different ways in which people are experiencing or like the outcome of the decisions that they're making, I believe that will lead to potentially more vaccinations. Yes.
So I remember when I was working with some of the doulas and talking to them and hearing their experiences, um, they would always tell us about the many concerns that these pregnant and breastfeeding women would have.
Mhm.
Um, are there any that we're still hearing about the vaccines more recently, like RSV, flu, and COVID, that are persisting even after the pandemic?
I mean, I think that largely it's what is the recovery, right? Um, what how will I, lots of people, have especially heard about the flu shot. I think what is a common perspective is I'm gonna be sick after, and I can't afford to be sick. So I'm gonna just have to protect myself in other ways and not be as dependent as I might be on the flu shot because I can't avoid that. I can't afford that downtime that comes very often with being with having the flu shot. I know for myself, even like I avoided it many years because I kept like the one person that I knew that got the flu shot all the time was like, oh, I'm gonna get the flu shot. I'm gonna be down, like, and I was like, damn, that's the shot. So forget it. I'm not gonna do that. Right. And
Yeah, yeah, I
and
agree.
then what ended up happening was that I got the flu shot and I was completely fine, right? But that had been after several years of watching them be my like primary guidance around the flu shot. And it wasn't until I started working in schools and I was like, look, kids be, baby, I need to get I need to have some additional supports. And that was, and I mean, the flu shot, plus, any other like natural stuff that I have, right? I take my vitamin C, I eat oranges, like I do all the things, right? I do protect myself, but also recognizing that this was another layer of protection for me. But until I did some additional research that, was like, oh, X amount of people might have pain at the site or just whatever. But really being able to do a little bit more information or secure more information so that I could learn more and make different decisions was what led to me making another decision. And I was really surprised. And so, and I mean, I'm just naming that the person that would consistently get ill as a result of the flu shot is my sister. So there's also that space of like, if my sister, we come from the same place, right? Um, we share DNA, like that's her experience. It's very likely to be mine. And yet what I found was that that wasn't the truth at all.
Yeah, a lot of the time, I know I've heard a few people, especially in my family, afraid of getting any vaccine because of the idea that it might affect them negatively. So that is definitely a fear, but everybody's different. Everyone's affected in different ways by these vaccines.
Right. And that's what we really want people to know, right? That someone else's experience, even if it might be horrible, might not be yours. Right.
Yeah.
And largely it probably won't be yours. So using somebody else's experience as like the determining factor of how you decide to make decisions is probably not so helpful, right? You want to look at the data and also inviting people to think about like all these people took this, got this vaccine and this percentage of people, and also we don't know what other predetermining factors they may have had, like all these things, right? It's important to really be able to have that conversation um, and to invite that dialogue without, so people should be able to say, I don't trust a girl. And, and me be able to say as a doula, I can see why, right? I totally can see why without feeling like somebody's trying to convince you to do something, right? Like I'm going to invite you to come along on this learning process. And at the end of the journey, you get to make decisions for yourself. But it's also a type of exchange and journey that often certain people are not brought on or included as part of their own learning, right? Like people always say things like, oh, parenting doesn't come with a guidebook, right? But it does come with guides. And if you are a guide, you're credible, right? People want to trust the direction that you're moving them, then I think that also does a lot for improving possibilities that people will have vaccinations. And again, like our important thing is we want you to have the information that you need to make the best decisions for yourself, your families, and your children.
Speaking of guides, I remember earlier you referenced Rooted LLC.
Mhm.
And they were a partner, and what they also gave you a guidebook, some resources, and even presentations. How have you implemented any changes in your organization, training doulas on vaccine education since you began working with Bronx Health Reach and Rooted LLC?
Well, if we're honest, like we really didn't train doulas specifically on vaccines, right? We didn't have the information.
Mm.
So that has actually been something specific that we've been able to offer is like, this is, evidence-based. It comes from medical folks. I forget her name, but one of them is a midwife, right? So we are trusting their guidance, and also their stuff is evidence-based. So I think that being able to create these environments where we're also leading these sessions for our doulas has also been really helpful because it expands what it is that we can, we send our doulas out into the world to meet with communities. And so being able to also offer them specific training around these things has been really, really helpful. And the guides from Rooted are, again, they're digestible, they're easy to understand, they are chunked, right? They're created for the goal of really being able to have these meaningful conversations between doula and pregnant person in a specific time frame. So I think that all of this is also really amazing and helpful.
Great. So how would you, because like doulas are very important, obviously, but
Yes, yes.
the foundation of a family is just as important, I would feel, of them not only being there and supporting, but also being educated um, about vaccine education in general. So, how can family members also encourage those women to get their vaccines?
I mean, I think again, it's about, if I'm honest, I think that the best thing that we can do is to create a container where people have the information. Um, and then inviting them to not just take it, right? I always say that information is best when it's not used like your grandma's good china, that it just stays in the cabinet. So I think sometimes people always like, oh, we want to have information. But for me, it's like, I'm going to give you this information. We're going to share. We're going to have meaningful conversations about it. And we're going to talk about it again and again, right? If I see something that feels relevant to that decision-making process, I sometimes remind you like, oh, what's going on? Are you on a delayed vaccination calendar? Are you deciding, what do you think about this that's coming up in the news, right? And it's not to be able to force someone to make a decision, but it really is to invite them to recognize that this decision is an important decision, and that it's not to be made lightly, and that there's information that they can utilize to optimize the way that they make a decision, right? And so this is one way. For me, it's like, for a lot of parents, they're like, wow, like I didn't realize how many decisions like this I had to make. So there's, for most children, most pregnancies, right, after your baby's born, even, there's like a calendar. At X amount of time you get this vaccine, at X amount of time you get that vaccine, right? What does it do for my baby? How does it benefit? Why should I, what would happen if I didn't take it, right? So really being able to offer like that brain decision making, right? Like, when people say like the benefits, the risks, what happens if I say no? What happens if I do, if I do nothing? So these are all skills ultimately that we are supporting the client and being able to acquire, because again, this is likely to not be the last time that they have to make a decision for themselves or their child. But again, having the tools, the strategies, the skills to be able to make optimal decisions for themselves is the key here.
Okay, great. Thank you so much, Evelyn. Uh, I didn't realize the wealth of information you had, but thank you so much for sharing it with us. Just to wrap up, can you tell people how to reach you, or what would be the best way to take advantage of any services that you offer?
Yes, please, please, please stay in contact. So we are Bronx ReBirth in Progress. We go by BX ReBirth. And we are available largely through email. So you can definitely send us an email at info@bxrebirth.org. You can also find us on Instagram at BX ReBirth Collective. And yeah, please feel free to send us a message, letting us know if you have any questions or if you'd like any services. We do all full spectrum doula support. So we are available, and also postpartum doula support. So if you are in need or know someone who is in need and lives in any of the 5 boroughs, but we prioritize the Bronx, please let us know.
Okay, great. Thank you so much.
You've been listening to the Bronx Health REACH podcast with your host, Anthony Davis. You can email Bronx Health REACH at bxhealthreach@gmail.com. You could find Bronx Health REACH on social media. For Facebook, Bronx Health REACH. For X and Instagram, BX Health REACH. The views, thoughts, and opinions expressed and presented by our guests here on the Bronx Health REACH podcast are their own and do not necessarily represent the views, thoughts, and opinions of Bronx Health REACH and the Institute for Family Health.